You will do no such thing.
Right, sir.
All right, we'll call the meeting to order for September 16th, 2025. Let's call for approval of minutes from May. Anyone want to make a motion to pass? Okay. All right. Let's move to standing reports. Program Agency Director.
So, just got back from the state council last week. Dr. She was up there for the standards and CMAC as well. A bunch of new stuff going on. There's currently 5 regulation packets going through various stages of approval. One specifically is the blood regulations for ground transport. And then there's an equipment build regulations. And then they have a regulation pack that was presented to the SEMSCO. You'll see it later on in the agenda, but I can cover it now. It was the equipment regulations for ambulances that has gone through 2 different evolutions of public comment. It's already come back, gone through all the final approvals, and was presented to the SEMSCO last week, which was approved. So there's I think there's about a 3 or 4 week period with of additional stuff that the Division of EMS has to go through, and then they'll set an effective date, which will likely be in the February or March timeframe for it to go live. I'll be sending out when the timing is appropriate for the effective date. The packet, it's a pretty lengthy packet of regulations. We have our conference. I'm going to start talking about that now. February 25th through the 28th, 2026, right here in Geneva. It's 2 days of actual conference, so a total of 16 hours of CMEs. And then there's 2 days of optional pre-conference sessions that folks can be signed up for. One of them will be a New York State instructor update. It's a 3-hour update, which is required by all CICs. At least once in their cycle period, they have to attend this type of session. The other one is the 2-day state leadership program. We offered that in the spring, and it was well attended, so we're going to offer it again here at this conference. And then there's a 2-day RSI difficult airway program that we'll be offering, which will, I think Dr. Lipp will touch on it, which will become our RSI training for any new providers for people. That course is a fairly pricey course, but the education group discussed it pretty thoroughly, and all felt that this was the appropriate way to go for standardization of the training. And that's all I'll say for now. I'm sure there'll be more.
LCC.
Well, you can do.
So Danielle Kirchhoff has started as the new part-time course sponsor coordinator. She's been with us about 6 weeks. I just wanted to provide a quick review of the fall enrollment. We currently have 23 students in total enrolled in the 2 fall classes that we are offering. They're EMT original and refresher classes. One is being held at the Ontario County Public Safety Training Facility. That one has 8 originals and 1 refresher, and then the other one here at the Geneva campus is 10 originals and 4 refreshers.
right, we'll move on to the medical director reports. I'll go through the investigations first here. So we have Evan Torres from New York for violation part 800.16, suspended for 3 years, effective 6/17/2025. State pending no further patient abuse violations during a 3-year probationary period. Assessed at $2,000 full count. Stephen Tanner from Warwick, New York, for violation of Part 800.16A13. Surrender effective 6/20/2025. Tonga Sarker from Queens Village, New York, for violations of Part 800.16. Suspended for 3 years effective 6/17/2025. State pending no further patient abuse violations during the period of probation period. Assessed at $2,000 full count. Benson Hurst Volunteer Ambulance in Brooklyn, New York, for violation of Part 822J and Public Health Law 30121B. Ambulance certificate revoked effective July 16, 2025. Amanda Usley from Wallkill, New York, violations of a previous stipulation order suspended for 1 year effective 8/12/2025. So coming from the Med Standards meeting, I'll kind of hit the highlights here. There's some discussions about the supervised airway having some additional updates and recommendations coming out. John talked about the blood regulations. It's going to be open for public comment soon, so we'll look forward to that. The big thing we did talk about is on the horizon for protocol update, we're going to add additional counts for support. There's growing evidence that it is good for multiple situations, so we're going to add a formulary. And the discussion is that it's going to be up to the region, likely the agency, to decide which ones to stop. That's on the horizon. Nothing set in stone quite yet. There's a specialty care group task force that's formed that's going to come out with new recommendations and guidelines for what to do with specialty care transport. It's not going to be regulation. Right now, the focus is just coming up with best practices for what to do going forward. Other than that, no protocol updates for this meeting. I think that's going to be on the horizon in the subsequent meetings. And that's it for my report.
So the one other thing that came out for CMAC was the Deputy Commissioner of Health was there and had mentioned that the Commissioner was not going to support the sundowning of the critical care tests, even though the curriculum has not been updated in 10 plus years, and suggested that we as like the training and ed committee at the state level and the SEMSCO and CMAC go back and have further discussions as far as appropriate sundowning, because apparently 10 years is not enough. That was left in discussion to go back to committees. I can tell you what a number of Remacs are doing. I'm not saying that that is the direction I'm encouraging, but there a lot of them are just saying we're not going to recognize the critical care level. Either you're practicing at a paramedic or the AMT level. In reality, the AMT level covers 80 to 90% of what a critical care tech can do. So, I mean, realistically, we only have maybe 3 to 5 critical care techs in our region, so it's not a huge impact to our region specifically. But down on the island and up in the Adirondacks, there's a sizable population of critical care techs.
Which is interesting because the creation and evolution of critical care tech was for rural EMS.
Yeah, well,
And
critical
it's-
care
and the
tech
largest number of-
evolved, right,
Yeah,
for
largest
the
number
rural
existing.
areas, and that was prior to paramedic programs being scattered and populated across the state. Early on in my career, I was a critical care tech, but as soon as classes started developing, it's only the natural evolution that you either go up or you go down.
Up until this talk about sundown, they still, Long Island area still had 6-month basic to CC classes.
Well, there's also Northwell College down on Long Island has what they call a critical care to paramedic bridge, and it's a very modified, it's a hybrid version where you literally you're doing the bulk of your class online and at your own pace, and then you only have to go in for skills. They've done probably 10 cohorts of these providers, and most providers are being proactive and upgrading. But for whatever reason, there's a population of folks that are resistant to that.
New York State has stopped, if I'm correct, has stopped offering a test for the CC, right?
That is correct. Yeah.
So with this delay or elongating sundown, right, those that are out there are still to be able to research
Only through CVs.
through CA pathway.
Nobody's offering any type of classes supported to that.
So
There might be a core class, but I don't think the state is approving those anymore. Brian, am I incorrect with that, or?
I'm not sure about the core class.
Yeah,
I just
that
know the
would-
only
that
way,
would be
the
the only-
only way you can recertify is through CME.
CME, yeah, that's what I thought as
Yeah.
well.
There's 492
that's it.
statewide.
That's it.
Yeah. So if you look at the PCR data, it's 1/10 of 1%.
No, we
I
don't need
cannot
a
do that.
One-tenth of
I can't even break it
1%.
down by regions. It's
Yeah,
statewide.
it's not that.
Are actually showing up on a chart.
25% in growth regions, 60 because our one is currently in paramedic.
Right. And I know of another one that has no intentions on doing that. It's just gonna go down with the 480 Yeah.
Out of the 482, how much are actually active? Oh, that's the question. I know you get a sacrament,
Wow.
I don't think that, I think it,
Actually, one in our region.
well, that's the point, is that when you break it down regionally, I can't break numbers down regionally, it's statewide, but the problem comes in where you have a single region that has a high density of them
Yeah.
that really controls and runs the region. And that's the overall problem, which is why John is saying that some of the regions outside of those areas are just saying, look, we're not even gonna recognize that anymore.
Right. And that's, quite frankly, that's an option, but I don't think that's an issue for us.
Yeah, we don't have enough to.
Right.
To even,
Exactly.
the fact we've spent this much time on it.
Well, I just wanted to bring it up because it was a pretty active conversation for the last 3 days that we were there.
And you can correct me if I'm wrong, because I wasn't there, but it was a very, very hot topic on Monday or Tuesday morning. And as the days went by, as more information got presented to the commissioner, that conversation got less and less.
Wow. The deputy commissioner was educated on many of the things that apparently he had little to no knowledge of. So I don't think it's going to be as big of an issue as we think that it's made out to be. But
And the other thing,
nevertheless, it's still an issue, that was presented to that group.
and I think the other thing is that the original proposal was to just extend it another 3 years. And so my thought when I heard that was, well, we've been holding on for 15 with another 3.
Well, but,
Exactly.
That's
That's what I was just telling Dave, like,
But-
I got
but the
mine in 98,
conversation-
and they were saying,
Yeah.
then, don't do it, because they're gonna be gone.
well,
I took my paramedic in 92. It was the same thing. It was like, no, don't take the
Because it
paramedic.
won't be around.
It was, oh, it's not going to be around.
yeah.
92.
We're one of the only states with it left.
We're the
Well,
state-
there are no other states that
Yeah.
recognize that.
So just.
It's not a national curriculum class that's taught.
So just so I understand this, the New York City area is not gonna recognize the New York State protocols, and now they're not gonna recognize the New York
Well-
State practice levels?
New York City area is very vague. It's specific. New York City has, they call them the unified protocols, which are almost identical, but they can't conform with us.
I think they changed those.
However, like Long Island, Nassau, Westchester, all those follow the collaborative protocols as we all do. So it's only a pocket. So we're almost 100% the same.
All right, we'll have, what?
So, kind of leading off of that, I don't have any additional information on it, but as the course medical director for the paramedic class here at FLCC, working with Maverick, the state actually, when we were going through the process of setting up the advanced standing class for practicing health professionals that have their EMT, to then, I don't like the term challenge in paramedic, but to basically get advanced standing for certain class work that they can place out of. Maverick was actually approached by the state to put together a curriculum to maybe do a CC to paramedic, which I was kind of surprised because this was a big, long thing that only Northwell was going to do it.
We've actually tried that, and when we tried that, we had no interest.
And no people that signed up.
Correct.
Oh, so it's on that. Okay.
Yeah, so we've tried that. I mean, it's really and truly a matter of hand-holding
Yeah.
for some of these individuals.
So the advanced standing class for health professionals, so like PAs, RNs, NPs, so on and so forth, RTs, you could, if you know any that are EMTs already, they can put in for the class and basically sit down and see what class work they place out of, get an understanding. So that is in progress. The class obviously hasn't started yet, but I think Maverick has posted on the website and has already got a lot of interest. We did not have an education meeting I don't think we had one since the last Remac meeting, just because over the summer break. But we had discussed at the last meeting a new RSI class. And we had brought in a bunch of ideas about creating our own class, writing our own curriculum, kind of redoing the curriculum that we already had, changing the whole format of the class closer to what the Flremsc region does. And then the final idea was actually to see what other commercial classes were available and are being used. And Air Methods had a program that they presented to the education committee that we looked through, and we actually got a lot of interest from the agencies. We looked a little deeper to see what they could work with the region to try and tailor the class to our protocols. We found out that I think it's 2 regions that are already using their advanced airway class, different airway class, as their RSI training. So we are likely going to adapt that as the RSI training. We're going to offer it as a pre-conference class for the Finger Lakes Region Conference. The cost, I don't know does anyone know the exact cost?
$650 is going to be the cost for the pre-con.
$650.
We understand it's a little pricey, but they're bringing in all their equipment, they're paying their own staff, so forth.
And it's going to be obviously lectures, and it's going to be practical skills. And then there's also, I don't think it's included in that class, but there's also the option that they have a new traveling cadaver lab with a truck format, I guess.
That is not part of that class.
Not part of that.
That's a fairly pricey venture, but if there's interest, we can certainly do
Yeah. After today, we're gonna send out some more dates, for the next education meeting. It's still open to everyone, whoever wants to participate and all. There also was, some, interest over where I work at Thompson, from nurses that were interested in, how to get their paramedic and get involved with EMS. So I was gonna see what the interest was among all hospital systems. I think I mentioned this, once before. To have like a nurses only EMT class, that would be, kind of, so nurses would be a good company and, could get through the class smoothly. We'll pick a good instructor. If any other nurses or anyone, even the doctors are interested in taking the EMT, reach out to me, put you on the list, and we'll put a class together. And then the idea would be that we would do the EMT, and then right after that, we would make a advanced standing class for the nurses to get their paramedic. That's it.
Just got if you work directly with us, we can facilitate that.
I can't hear, sorry.
If you work directly with us in the office, we can facilitate the EMT level stuff.
Awesome.
So the cost, is that on the agencies or individual for the course?
So for the RSI class, so for the RSI class, it's going to be up to the agency if for each of them how they want to handle it. If they want the provider to pay for it or the agency to pay for it, it would be my assumption that the agencies want them to perform it. That the agencies would pay it. Right? You know, each agency is going to be different.
And the caveat for that class is there's a 12 student minimum, so if there's not 12 students, then
They will run.
that would be canceled.
I guess not just open to people that want to do RSI. It's open to anyone, even outside of region, that wants to attend a class.
John, just for your, my plan is to send 5. If
Outstanding.
Right now, I've got 4. Next question, is there a cap?
I think the cap was 20 to 30.
Yeah, I think the cap was 30, yeah.
Yeah.
Close.
It seemed like they were going to incrementally provide more staffing, right?
Yeah.
Instructors as the class got bigger.
There was the bottom, and then they were able to facilitate.
I mean, if you got 60 people that register and want to do it, then we'll find
What
a staff.
happened?
figure it out.
Well, we may not have-
that day?
Yeah, we have fees for that.
Yeah, but I mean, just saying, you know, we'll make it work.
Sounds like we'll have an issue with numbers. Anything else? Old business, the collaborative protocol updates, they're live in July. The links are here on the agenda. Does anyone have any comments? New protocol changes? Okay. New business, John talked about the new equipment regulations. I guess we'll have a list of all the changes.
Yep, I'll send it out to the group when after the state has marked the date for going live. Currently, they didn't want them released until, the go live date is not established.
And please encourage your providers to sign up for the region so we can keep an eye on what providers are.
Yeah, so there's a Central New York link on our webpage that is simply a registration point, just so we can kind of know who's practicing in our area. It doesn't limit people. There's access to various testing situations, like there'll be protocol updates. There's a ketamine program that they can do, so they can do some educational components on that site as well.
And Pulsar,
So URMC and Rochester Regional and Pulsara, specifically in the city, and is supposed to be branching out as time goes by. if you're not familiar with Pulsera, it is a notification. Providers simply download it on their app, and they pick their hospital that they're going to, and they can provide patient updates, SEMI alerts, stroke alerts, trauma alerts, and just various information that can go directly to the sending hospital, and they have the reports timely.
But the utility of some of that, like the stroke alerts, STEMI alerts and whatnot, that's not in the base package.
Well, I
That's
haven't
So,
seen
we've
your
seen
end of
some-
it. I've only seen a little bit from our side of it.
Yeah. So there's been some, I don't
I know
think
there's
either
been some
RH
hiccups,
or Strong did those packages to begin with, but I think both, I know at least our RH is talking about looking at the additional functionality. So I don't know if you've heard anything about what you guys aren't using it at Thompson yet, are you?
Rarely.
I was gonna say,
It's more, it's
Bob, I
more,
saw
we have
Justin
it,
say
it's all
that
installed.
groundwork is being laid.
It's dependent.
That's where we're supposed to be there very shortly at Clifton Newark. We're supposed to be
What does it do differently for the stroke alerts and STEMI alerts?
What's that?
What does it do differently with this, like, for the package? Like-
So it's one that it turns into a messaging thing where you can have it ping, the interventional cardiologist and the ED and the cath lab and, so.
And many of the other regions, like Central New York, and other regions across the state are already have that active, so.
Yep.
We're kind of like the last little pocket within the state to have this up and running. So, we have access to some training components. If anyone is interested, I can get you set up with that. So, just let me know if anyone has any interest.
So when I was asking questions with Pulsera and stuff.
Well, they're also generally a vendor at our conference, so there's representatives.
So I was talking with Justin, our ED nurse director, about it, and I said, well, can, all the providers, get Pulsera on their phone, and it turns out it wouldn't work, because what would happen is, if like all the providers that would want to know about incoming patients had it on their phones, the second somebody acknowledges it, I guess it disappears.
Yep.
So then, so that makes sense that, the setup for like STEMI, stroke alerts, things like that is, if you want to have multiple roles in multiple people, then you have to pay for that package.
Are there other services that do this, or Pulsera is?
There's one other one, it's called Triage. But they have no real footprint within the state. There's a couple small pockets that utilize it, but that's it.
I think CMC is the only one in the area that I know uses it.
No, there's a couple of small pockets.
Yeah.
So that was a merger of what two roles?
John, do you know if any people in the state are using it for telemedicine, teleevaluation? When I originally looked into it, it was talking
The Pulsera.
Yeah, pie in the sky, iPad, patient doesn't actually need to go to the hospital.
I don't, but let me ask some of the regions that are live with it.
Yeah.
And I'll ask, I've got several counterparts that are versed with that, so let me check with them.
Cool, thanks.
Probably the most possible especially down in the city where most of the ambulances are integrated with a hospital. I think the setup down there is a whole different ballgame.
Right. Well, and so are the financial resources.
Yeah.
All right, so the only other thing I had from the state is, I don't know if it applies to a lot of providers here, but for those that are going through the ultimate pathway, there's a glitch, I guess, with the National Registry website. So there was a 6 to 8 just delay to get verification, as opposed to usual.
So they're trying to software update, they're trying to launch into a new program, and it is not transferring the information, and it has become very difficult for the state to verify the actual information. So even if you were to take a national registry test, the state is still having difficulties verifying that you actually passed that said test. So national registry's actively working on it. So the state's just forewarning everybody. Their recommendation is for, at least the immediate future, is to take the state test and then go backwards through the process. That way you're still certified and you can practice, versus potentially a very extended delay in verification and receiving your certifications.
Is this affecting people who are previously?
Everybody in your systems.
So I should check to see if I'm still certified.
That'd be good.
Are you practicing anywhere outside of New York?
No,
Then
but I
probably
just don't want to take another.
doesn't matter. You'll probably catch up with you.
Yeah, that's good to see.
Any other new business?
Next meeting is November 18th. Anyone has any agenda items, please forward them. I did send out the meeting dates for the next through, I think, July or September of next year. If anyone did not read them, let me know and I can send them. They're also posted on our website under the meeting tabs.
All right.
State conference?
Oh, the Vital Science Conference?
Yeah, that one.
You know,
Why don't you talk about
I
it?
actually had it written down.
There you go.
So Vital Science Conference is in Syracuse, New York on November 11th through the 15th. They kind of moved the dates up so they could give people back at least one day of their weekend. So November 11th through the 15th, registrations are open and log on to their website for more information.
All right. That's it. Call the meeting to an end. Anyone want to make a motion?
Motion.
All right.